Hi class! We are entering week 2 of clinical psychology. I am impressed with your work from week 1 and still finishing up some of that grading. Please keep up the good work. I've really enjoyed taking a look at your really thoughtful and considerate comments to one another on the discussion board and how much work you've put into just your first discussion and assignment. So thank you. Week 2, you'll notice that we are beginning to take a look at differential diagnosis and how do we structure and create very sound initial appointments with patients or clinical interviews. What are the ethical considerations and how do we make sure these are the most sound and valid, comprehensive interviews that we have? So, and then next week, you'll notice we're extending on this regarding our learning about clinical assessment and then focusing a little more on the actual instruments or measures themselves and how we might combine instruments and measures for different settings as well. But again, this week is more about ethical considerations and information we're gathering to start to understand a presenting problem and diagnoses, as well as what are all the questions that we most want to consider in a very sound interview. So please let me know if any questions come up about the reading or assignments as well. But for this week, for your discussion, you will be describing some of the advantages and disadvantages of mental health diagnoses. What are some of the ethical considerations? There's quite a few that we want to consider. There's a lot of ethical reasons why we must try to be as most accurate, but we also do not want to be obviously providing more diagnoses than necessary or inaccurate diagnoses. And how do we also consider presenting that information in writing or to the patient? Also, the 2 assignments due this week. One is describing the nuanced differences between crisis intervention and short-term therapy. Of course, there can be a little bit of overlap between those two, but there are also very stark differences. We'd like you to utilize at least 2 empirical research or forms of literature to help support your claims with this visual presentation, but hope that you can highlight some of those key differences between crisis intervention and short-term therapy for that visual assignment. And then for your second assignment due for this week, week 2, we're getting creative here and we're asking you to pretend that you're a supervisor working with new trainees or interns and helping them understand all that's important to consider for that very full initial first appointment or clinical interview with a new patient. What type of information do you want to make sure you give off right off the bat? Of course, very thorough informed consent and reviewing all of the limits of confidentiality. It's quite important to start an appointment that way so they're fully informed. In addition, what are some of the really pertinent questions you might want to consider in structuring this script or outline for a clinical interview? So the assignment's asking you to come up with at least 12, if not many more, questions that we would want to gather during an initial appointment. To how do we figure out we're figuring out how do we want to come up with case formalization, or obviously we call it case conceptualization many times. How are we taking a look at their presenting problem? When was the onset of this? What were key factors influencing the development of this? What are their current symptoms? Intensity, severity, duration? What are cultural considerations, and what are the different impacts of this across many areas of functioning? There are, oftentimes we want to get a better data of their day-to-day life and symptoms across sleep, eating, hobbies, interests, relationships, substances, just to name a few. What is their financial or work employment situation? How are things getting better or worse, for example? And what would you want to include and make sure you taught interns to consider for being what's most important and coming up with that outline or structured interview? And then we're going to have you present this information in a mini video format of an educational video of all that's important to consider in that first appointment. When we look at clinical assessment, we are usually combining a very thorough clinical interview with structured questions along with some types of either self-report measures or clinical assessments. So we hope you can take a stab at this. If there are any questions at all, please don't hesitate to reach out via email. Of course, I can make myself available over video or telephone as well. Don't forget to look at the rubric, the grading rubrics before you submit your work to make sure you're really hitting all the key areas of which I'll be grading you on. And many times part of that is including empirical literature and following American Psychological Association formatting well. If you have questions about any of that too, just let me know. I look forward to working with you, and you will see another video from me for next week. But until then, happy learning and reading, and I will speak to you next week.